Dr. Vashi, thank you for joining us on MD Newsline podcast. Can you please introduce yourself to our audience?
Yes, thank you so much for having me. Dr. Neelam Vashi. I am a board certified dermatologist. I practice here in Boston at the Dermatology Institute of Boston.
So, can you explain a little bit about what psoriasis is and how you explain that to patients when they first come in?
So, yes, when patients come into my clinic, I generally describe psoriasis as an attack on the skin in the way that it is a chronic immune driven disorder that in which there are signals to the skin in that it tends to produce thickened skin, extra skin.
So, when a patient comes in, what's the typical patient journey to diagnosis? Do they come straight from primary care? Have they been kind of on a journey with different misdiagnoses? What are you typically seeing?
Every patient that I see starts with a story, and every story is very individualized. I generally treat adult patients, so their journey has often been either from childhood or adolescence. Sometimes they are coming to me from another physician as a referral with a diagnosis of psoriasis. Alternatively, they have come with just itchy spots on their skin or a burning sensation in their scalp. So, the journey and the story of the patient can be very unique to the patient, also in regards to what they've tried, what they've felt, and the impact that it's had on their life.
Mm. And psoriasis maybe used to be described as a skin disease, but now seems to be more kind of discussed, as you mentioned earlier, as an immune mediated systemic condition. Why does that matter in that shift in understanding when you're talking to patients, for instance, and why does it matter to think of it like that in a clinical setting?
Yes, it's very important for both patients and clinicians to understand psoriasis as a systemic issue, not just the skin, because there is systemic inflammation. Why that's important is because while we can see it on the skin, we don't see it necessarily inside one's body and inside the other organs. So we know that psoriasis can cause inflammation in the joints. It causes cardiometabolic changes as well. So it's very important to address all that for healthy lifestyle changes and different treatment paradigms that we may follow depending on the inflammation or the other organs that are involved within one's body.